Okay, so our next speaker starting this session is Stephen Parsons. Stephen Parsons is from Suffolk, and Stephen's going to be talking about evaluating the impact of right care, right person. Hi, Stephen.
Hi, everyone.
Lovely.
Cool. Thank you.
We can see your screen. That's brilliant.
Lovely. Cool. Thank you very much. So, thank you. As was said, my name is Stephen Parsons. I work for SODA, which is the Suffolk Office of Data and Analytics. And as was said, I'm here to talk to you about the Right Care, Right Person dashboard that we have produced. So, a little bit of an introduction to SODA for you. So, we are a function of the local government. So we are funded equally by local authorities, Suffolk Police, and the ICS in Suffolk, which is Suffolk and North East Essex. And we are here basically to advance the data and analytics agenda across the Suffolk system to build a local picture of Suffolk's residents and communities. So we were commissioned jointly by Suffolk Constabulary and the ICS in Suffolk North East Essex to look at the impact of the Right Care, Right Person initiative. So for those of you who aren't aware, Right Care, Right Person was implemented across police forces in England and Wales to look at calls that are coming into the police, which aren't necessarily the best agency to be dealing with those sort of situations. So particularly, they were looking at calls for service relating to mental health, where the police were often trying to work in partnership with other agencies, but if the call came in to say 101 or 999, but it was primarily a mental health issue that was being dealt with rather than a crime that was taking place. The police often felt like they weren't necessarily the best people to be dealing with that situation. And so since in Suffolk, since October 2023, they've looked to phase in the implementation of this initiative, which is effectively referring these calls for concern for welfare to the right agency. So these were initially just for those concern for welfare calls, and then as it was implemented in phases, they later included calls for walkouts from healthcare facilities, those who go AWOL from mental health establishments, and then also looking at the transportation of patients under the Section 136 Mental Health Act, where some of these patients are often being transferred in police vehicles, which weren't necessarily considered the best kind of method of transporting those patients. So they were kind of referring those to other agencies as well. Now, initially, there was a bit of concern among these other agencies that they were going to get inundated by these kind of additional calls, additional demand on their services that the police were previously dealing with. So we were tasked to do an evaluation of that, just to look at the wider impact on the system. So, as I said, the partners in the system who would be getting these referrals from the police, they wanted to understand the implications of this initiative. And so what we did was to collate the demand data across the Suffolk system. So particularly, we looked at data from Suffolk County Council and the health data, and then match that to the Suffolk Constabularies, the calls that they were referring, just to kind of see the levels of demand for services that were increasing or not, depending on how many of these referrals are going through. The one thing I do want to note is that we didn't use identifiable data and track people through the system. So we didn't require the additional governments that would be required for that. So DPIAs or ISAs weren't required for this project because we weren't tracking individuals from one organisation to another. We were literally just looking at call volumes and the overall demand on the services. So how do we approach this? We use Suffolk Constabulary's data as our primary data source, and then built a Power BI dashboard to track the amount of referrals that were coming out from Suffolk Constabulary, and then looked at so this chart on the bottom right here is showing where in the blue and the green, that is the overall demand on the calls coming in to Suffolk Constabulary. And then from 2023, we've got yellow and red, which are two of the phases where we've been able to track calls being referred through Right Care, Right Person. And then that's you can see there, the subsequent demand on the police dropping off. What we were able to do is match these referrals to Suffolk's population health management system, which is Axiom, which is a system provided by the North East Commissioning Service, NEX, and as well as the children and adult social care data, which we collated from Suffolk County Council to assess the relationship between the referrals coming out and also the demand on these services. So what we did was to produce this dashboard. This is an example of one of the pages that we produced for the ambulance services. So for this, we just looked at for this particular chart, ambulances dispatched for psychiatric conditions. So in the yellow bars here, you have the referrals that have come through the police. And then in blue, that is the number of ambulances that were dispatched based on the ambulances which were listed as having a psychiatric flag as the reason for their dispatch, and then we collated that for the areas. It's slightly complicated in Suffolk because for Suffolk, we actually span two ICSs. One is Suffolk and North East Essex, and the other is Norfolk and Waveney. So we had to collate some of that data together from two population health management systems, and then track it against the police referrals. And you can kind of see here on the chart with the dots on the right, this is looking at the correlation. So as ambulance referrals went up in Suffolk through Right Care, Right Person, we did see a greater demand on the ambulance service. So we could kind of say that, yes, there is some kind of relationship. Difficult to establish causation here, but that wasn't necessarily the goal. It was, we were trying to basically see, is there a correlation between general increased demand on these services? And we did find that with the ambulance referrals that we looked at. So for next steps for the dashboard, we looked at the purpose of the dashboard was primarily to answer the question of what extent is Right Care, Right Person affecting the partner agencies, and how we wanted to assess the relationship between how these referrals from the police led to increased demand. Linking police data, Suffolk County Council and health data, we were able to show broad brushstrokes that the services which were affected, so the ones that we looked at were ambulance, where we saw the clearest correlation I showed you on the previous slide, but we also looked at the demand on 111 calls going into that service. We looked at the referrals with Suffolk County Council. We looked at referrals into we looked at the referrals into children and adult social care and those call volumes that went into there to see whether, and the multi-agency safeguarding hub in Suffolk, we kind of tracked that just to see, is there an increase in the kind of safeguarding concerns? But also from the health side, we, as well as ambulance, we also tracked call volumes into 111, just to see whether that service in particular had increased demand with that. We didn't find much of a correlation there. It didn't seem to have much of an effect. Similarly, with the other two areas that we looked at were demand into emergency care. That was really specific, looking at kind of alcohol and like substance abuse calls into emergency services. Again, we didn't find a particularly increased demand there. And finally, we also looked at mental health referrals, mental health patients where there was some kind of police involvement or kind of involvement with a particular like mental health institutions. And again, there weren't huge correlations that we found. So in some ways that was really encouraging because we found that that there was a big concern when this was initially kind of proposed as an idea by the police that these services might be overwhelmed, that they wouldn't be able to cope with this increased demand when they were already had been facing resource pressures. However, we are aware, and it's really important to note that that what I've presented here is just the quantitative data, right? And that numbers only really tell part of this story. So one of the next steps that we're looking at for this project is to do some more qualitative evaluation, perhaps set up some focus groups, or to conduct some interviews with partners and stakeholders in the wider system, just to see their perspectives on this as well. Because overall the demand doesn't necessarily show that it's had a massive effect. It may be that in particular parts of these services they might find that, and maybe if we tracked different things we might see more of an effect. So we really wanted to look at the wider system impacts, look at how one organisation and one policy that an organisation has an effect on other parts of the system, because we're very aware that these services are all very interconnected. So hopefully once we do that qualitative evaluation, we might be able to give just a more rounded view of the providing a deeper understanding of the impact of right care, right person on the wider system. So that is it from me. Thank you very much for coming and listening. I'd be really happy to answer any questions that you have. This is SODA's email address, so if you which will come through to me. So if you are interested, you want to know more, do email us here. I'd be really happy to kind of take you on a bit of a deeper dive of the dashboard if that would be interesting for you, if that's something that you're looking at in your area. So yes, thank you very much for listening, and I will stop sharing my screen.
Thank you, Stephen.
Thank you very much.
That was beautiful timing as well. We've got a couple of minutes left for questions, and you can also, if you think of a question later, find Stephen on the participants and drop him a message. I guess I was interested as a sort of analyst, linking up constabulary data, county council data, healthcare data. There must have been some big challenges there. What was like the hardest, knottiest problem you had with sort of linking up all these different bits of data?
It was really challenging. I think one of the biggest ones was that our Axiom, our population health management, that was split across two areas, so they were completely different systems. Getting the same data out of both was complicated. Also, our population health management is in a secure data environment, so we had to aggregate all of the data in there. We pulled it out through a Power BI gateway, and getting the permissions and the understanding of what we were trying to do for that was a big challenge. So that took a long time, which is kind of why I'm presenting this now when it was instituted 2 years ago, because it just took a long time to get through those systems. So like I said, we weren't linking identifiable data. That would have been a whole other layer of challenge, but to do this across different organisations was challenging enough in many ways. So,
yeah, that's a brilliant piece of work. And then I guess you've got the challenge of what do you actually present in the dashboard as well, right? You've put all of that effort into pulling it out, and then you have to work out, well, how do we want to tell this story, and who's trying to use that? How is that bit of the process?
So that storytelling aspect, I mean, so the charts that I showed of the ambulance, that was quite typical. I did that for the mental health, the ambulance, for the other kind of health areas, and a similar system, but obviously with Suffolk County Council, it was different data. So for that, I was much more looking at like call volumes into their teams for, so we use customer first as our kind of contact center. So I kind of looked at that data. So I think it really depended on the data set. As to how I kind of presented it, but yeah, I think the main thing was what I tried to do was, because the police data, I aggregated it by month, I was able to kind of show that tracking over time because it's also something that would change as time goes on. So yeah, so that was the charts that I kind of showed were kind of fairly typical.
Brilliant. Thank you so much for sharing your work here, Stephen.